Turn on the switch. Select ultrasound. Set the frequency to 1 MHz. Set the intensity to 0.8. Duty cycle 100%. Preheat is off and the timer is set to 8 minutes. Press the start button. In order to check if the ultrasound probe head, that is the transducer head, is working or not, add a few droplets of water and turn on the machine. If you see a ripple effect, it means that the ultrasound probe head or the transducer head is working. Turn off the machine. Now apply a generous amount of the gel on the transducer head and a small amount of the Diclofenac gel, that is the painkiller gel. First apply the transducer head over the skin and then turn on the machine. Move the transducer head in the figure of 8 direction or in circular motion. Avoid keeping the transducer head in a static position. If it is kept in a static position, the patient will complain of a burning sensation. Hence, the transducer head is supposed to be moved continuously. Step-by-step guide and points to remember is provided in the description box.